Okay, we are now ready for the last part of our program. So if I could ask all of you to please pause. And before we have the presentation of the awards, I'd like to ask Virginia Reno to join us. And Virginia's going to read some remarks that have been prepared by someone very important in Bob Ball's life who couldn't be here, but he did ask that these remarks be read. So, Gina?
Well, thank you, Bill. And I am here to present remarks that Tom Bethel made, these explaining his recommendation for why he chose Nancy Altman to be the recipient, one of the recipients of the Bob Ball Award this year. Tom Bethel, if you don't know, was a lifelong friend and collaborator with Bob Ball. And he was kind of Bob Ball's sidekick and aide in Bob's second career that began in 1973 when he left government as the Commissioner of Social Security and continued on for another 35 years where he worked with Tom Bethel. Tom's remarks are, "I'm sorry I can't join you this evening, but Bill Arnone asked me to say a few words about why I chose Nancy Altman to be the Robert M. Ball awardee this year. I'm happy to oblige. And you will be happy, I hope, that these remarks clock in at under 3 minutes. Working with Bob Ball, I learned what principled advocacy means. Principled advocacy means articulating and promoting a position, a policy, or some point of view based solely on facts, supported by verifiable data. Seems almost quaint today, but it was Bob's modus operandi and a major reason why he was such an effective Social Security advocate. Bob met Nancy in 1982 when he was the key member of the National Commission on Social Security Reform, better known as the Greenspan Commission, and Nancy was Alan Greenspan's able assistant. As Bob later wrote in his book on the commission, she was already familiar with Social Security, but rapidly became an expert. Her intelligence and objectivity were major assets, and her expertise has served the nation well ever since. In my judgment, she would be an excellent Commissioner of Social Security." At Bob's behest, Nancy became one of the founders of the Academy in 1986. Since then, she has doggedly and skillfully made the case for strengthening Social Security without cutting benefits, and for helping SSA improve delivery of those earned benefits to the more than 62 million Americans who count on them. I will leave it to others to praise Nancy's books and articles and her leadership of Social Security works. I will simply close with the observation that no one has done more to uphold Bob Ball's banner of principled advocacy, and with my hope that in 2021, the president then will have the wisdom to nominate Nancy Altman as the next Commissioner of Social Security. Meanwhile, with regard to giving her the Robert M. Ball Award, I have only one question for the Academy. What took you so long?
Just as a point of clarification, I don't want any misinterpretation. When Tom says he chose Nancy, he nominated Nancy. The committee chose Nancy. Otherwise, I want to do this to protect Tom. He'll get hundreds of phone calls saying, "But what about me?" So I didn't want to put him on the spot. I also want to read comments submitted by Henry Aaron, a founding board member of the Academy, who couldn't be here. He says, "I regret being unable to be with all of you tonight to celebrate the well-merited presentation of the Robert M. Ball Award to Stuart Altman and Nancy Altman. Anyone interested in healthcare policy has benefited from the illumination shed by the work of Stuart Altman over a period of 5 decades. As a researcher, government official, teacher, academic administrator, and organizer of the annual health policy journey to Princeton, he has earned the Ball Prize many times over. So has Nancy Altman with respect to Social Security. She has fought to support and improve the most popular program run by the federal government for nearly as long as Stuart has done healthcare policy on Capitol Hill, on the enormously important, if somewhat misunderstood, Greenspan Commission, as author of superlative books on Social Security, as a founding board member of the Academy, as an organizer of influential advocacy organization, and most recently, as a member of the Social Security Advisory Board. Henry says, bravo twice over to, and I told him I couldn't say this, he said, to NACI. It's to the National Academy of Social Insurance, otherwise known as the Academy. It's for having the good sense to recognize the two recipients of this year's award. So in absentia, let's thank Henry for his comments. And now the highlight of the evening is to present the awards. We're going to start with Nancy Altman. I'm going to ask Nancy to join us. I'm going to ask Kalolo Kijakazi of our board of directors to join me to present the award to Nancy. So now really the highlight of this evening is the acceptance speeches of this award from the Academy. First by Nancy Altman and then by Stuart Altman. So Nancy, we start with you.
Thank you, Bill. Thanks also to Eric, John, Dave, and Senator Sanders for their wonderful remarks. Thank you to the selection committee and the board for choosing me, and to the events committee for planning this terrific evening. And thank you to everyone who is here tonight. I consider it an enormous privilege to have known Bob Ball. He was dedicated to public service. Many here tonight share that dedication. The entire nation is fortunate to have so many talented, public-spirited people choose a career of public service. It is disgraceful that civil service is under such fierce and ongoing attack. In honor of Bob Ball, let's have a round of applause for today's civil servants in this room and elsewhere who are following in Bob's footsteps. I and a number of others here tonight were fortunate to know Bob Ball, as well as Bob Myers and Wilbur Cohen. They were all young men when Social Security was enacted in 1935. Wilbur and Bob Myers started their Social Security careers in 1934, the year before it was enacted into law. Bob Ball was a latecomer. He began in 1939. All three spent their adult lives literally until their dying days dedicated to protecting and improving Social Security. All three spoke to me of their mentors, Arthur Altmeyer, Ed Whitty, and others. They referred to those who created Social Security as giants. Although many in the room may not realize it, all of us form an unbroken thread leading all the way back to President Roosevelt, Francis Perkins, Altmeyer, Whitty, and the others. These founders had a bold vision one that they passed on to Bob Ball, Myers, and Wilbur. The Bobs and Wilbur, in turn, passed the vision to those of us who knew and worked with them at the start of our careers. And we, in turn, worked to pass that vision on to younger colleagues today. So what was that vision? The founders recognized that security, whether physical or economic, is best achieved through cooperative collective action. And the way we manifest and implement our united action is through our federal government. At the base of economic security is a good-paying job. To ensure at least a living wage and a reasonable workday and week, we need minimum wage and maximum hour laws and the right, the protected right, to collectively bargain. To be prepared for our chosen career paths, we must be educated. They recognized that even with an education and good-paying employment, we and our families are still not economically secure without wage insurance. Wages can be lost as the result of unemployment, death leaving dependents, short-term and long-term disability, and old age. And they recognize that undergirding all of that, people must be healthy. We must have guaranteed health care starting at birth. All of that was encompassed within the founders' vision of Social Security. However, over time, our definition of Social Security narrowed. Just Title II of the Social Security Act, wage insurance in the event of old age, long-term disability, or death, is what people today think of when they hear, read, or use the phrase Social Security. Founder Arthur Altman mused about the phrase 30 years after the program's enactment. In a 1965 speech at a banquet honoring his protege Wilbur Cohen, Altman said, quote, "The term Social Security captured the public imagination, not only in this country, but throughout the world. In the course of time, the term came to be used in other countries in an expansive sense as a synonym for the good life. However, gradually the term Social Security in this country, instead of being used in a more expansive sense, has been used in a more limited sense to refer only to the old age survivors and disability system. I, Arthur Altman said, consider this extremely unfortunate," close quote. But even today's narrowed, limited definition of Social Security has been too much for some. There have always been those who oppose Social Security. President Eisenhower described those opponents in a 1954 letter to his brother, in which he wrote, "There is a tiny splinter group that believes you can abolish Social Security. Their number is negligible and they are stupid," close quote. Those who oppose Social Security today, today's small splinter group, never come out and admit that they oppose Social Security. Rather, they try to convince the rest of us that the wealthiest nation in the world, at the wealthiest moment in its history, all of a sudden can no longer afford Social Security. A striking example is President George W. Bush. In his 2005 State of the Union address, he said, quote, "Social Security was a great moral success of the 20th century. The system, however, on its current path is headed toward bankruptcy." More recently, the 2016 Republican Party platform drew from the same playbook. The Social Security plank was entitled "Saving Social Security." The section claimed, quote, "Everyone knows that Social Security's current course will lead to a financial and social disaster. But as the following two graphs show," oops, there we go. "Our Social Security system is unquestionably affordable. This first one shows that at the end of the 21st century, Social Security will cost as a percentage of GDP not much more than it costs today. The cost is basically a straight horizontal line." And the second slide shows that other industrialized countries spend considerably more today as a percentage of GDP than we will at the end of the century. The issue of whether to expand or cut Social Security is not a question of affordability. It's a question of values. Expanding both Social Security and Medicare is extremely wise policy. Both Social Security and Medicare have stood the test of time. Social Security is much more efficient, universal, secure, and fair in its distribution than any private sector counterpart is or could be. The same is true for Medicare. Social Security and Medicare together demonstrate the striking superiority of government-sponsored wage and health insurance over their private sector counterparts. Insurance is most efficient when it has as large a risk pool as possible. The only entity that can require universal mandatory participation is the federal government. Instead of high-paid CEOs, Social Security and Medicare are administered by government employees whose salaries are modest. With Social Security and Medicare, no one is seeking profits for shareholders. No one is spending money on advertisements to gain market share. It is for these reasons that Social Security and Medicare can spend so much on benefits and so little on administration, both in absolute percentage terms and in comparison to their private sector counterparts. And insurance is most secure when the entity providing the insurance can't go out of business and has the power to tax, when its assets are backed by the full faith and credit of the United States. Expanding Social Security and Medicare is what the founders intended. FDR described Social Security as, quote, a cornerstone in a structure which is being built but is by no means complete. Bob Ball said and wrote that he and the other founders intended Medicare to be the first step toward Medicare for all. Expanding Social Security and Medicare is also the will of the people. Poll after poll reveals that the American people are overwhelmingly united on this subject. Tea Partiers agree with union members, Republicans with Democrats. All ages, races, genders agree. Overwhelmingly, the American people want to see these programs expanded, not cut. There's a clear reason why Americans overwhelmingly support these programs. They represent the best of American values. Embodied in the fundamental structure of Social Security is reward for hard work, prudent, responsible management, shared risk and responsibility, concern about family, community, and nation, and self-reliance and freedom. In 1953, President Eisenhower may have articulated best the relationship between Social Security and self-reliance. In advocating the expansion of Social Security, he stated, quote, retirement systems by which individuals contribute to their own security are but a reflection of the American heritage of sturdy self-reliance, which has made our country strong and kept it free. The self-reliance without which we would have had no Pilgrim Fathers, no hardship-defying pioneers, and no eagerness today to push to ever-widening horizons in every aspect of our national life. The Social Security program furnishes, on a national scale, the opportunity for our citizens through that same self-reliance to build the foundation for their security, unquote. In addition to self-reliance, Social Security frees us. An independent, guaranteed income provides the freedom to choose whether to live independently in old age. Before Social Security, Americans had no choice as they aged. They moved in with their adult children, or if that was not possible, they literally went to the poorhouse, an institution that existed in every state but New Mexico when Social Security was enacted. Before Social Security, people with disabilities and the survivors of a worker who died were left destitute. forced to beg on the streets for the bare necessities. Indeed, children who lost a parent often were sent away to live with other relatives or even to orphanages because their surviving parent could not afford to keep them. Today, Social Security replaces that lost income. It provides the freedom that keeps families together. These are values that unite us. Social Security and Medicare unite us. If the anticipated blue wave actually materializes in the upcoming election, it will be significant for Social Security, Medicare, and the other programs which are the Academy's focus. Representative John Larson has introduced Social Security expansion legislation, which has been co-sponsored by 172 members of the House of Representatives. If the House returns to Democratic control in the next Congress, Larson will chair the Social Security Subcommittee of the Ways and Means Committee. If that happens, he has already said that he will hold hearings on expanding Social Security. After hearings, there may be a vote in committee and on the House floor. That will put pressure on Republicans. If they vote against expanding Social Security and restoring it to actuarial balance, or if they propose an alternative that cuts benefits, they will likely be held accountable at the voting booth. They may feel they must go along. I believe it will not be long before we once more take steps towards the founders' vision. It may not be in the next Congress, but I believe it is coming. It is coming because it is profoundly wise policy and profoundly winning politics. There are not many issues with that powerful combination. The vision of increased economic security was the vision of Bob Ball and his mentors. It's the vision of those of us in the room who admired and learned from Bob Ball. It is the reclaimed vision of today's Democratic Party, which seeks to build on the cornerstone laid down by Franklin Roosevelt. Providing expertise to those who embrace the vision is why this academy is so important and will become more important in the future. It's why I am so proud to have been on its organizing committee, a founding member, and on its first board of directors. It's why I am especially proud to receive today's award named in Bob's honor. Let's together keep up the excellent and important work Bob envisioned when he formed the Academy's organizing committee. Thank you.
What can I say? So when I got the call from my good friend Bob Berenson informing me that I was going to be the recipient of the Bob Ball Award, I was sort of a little blown away. I have had, over the many years, the tremendous respect for the Academy and all that it does. And I have been a big, big believer in Medicare and what it has done and how it has been a central force in our supporting individuals, but more importantly, making our healthcare system the quality institutions that it is with its problems. But also, I work with Bob Ball. Now, I have to admit that Bob Ball and I didn't always agree. So I'm about to tell you an almost true story. You know, it's been 45 years, so occasionally I might miss a few facts here and there. But you know, for academics, it's close enough. So here's the story. In 1971, at a very young and tender age, I became a pretty high-level official in what was then the Department of Health, Education, and Welfare. In that department was both Social Security and Medicare. Now, how a good Bronx boy who sent out letters for the Socialist Party in the Bronx wound up in the Nixon administration, I do not have enough liquor to explain. But if you give me a few extra, I will explain it. So there I was in 1971 as the Deputy Assistant Secretary for Health Policy. Soon after I got into HEW, the good conservative Republican president, Richard Nixon, imposed wage and price controls. Anybody remember in this audience, wage and price controls? I think the only person that didn't know he did it on a Sunday was me. My 7-year-old had scored her first goal, and I was a happy father. So I came into my office on an August morning, happy camper, and my secretary was as white as a ghost. The White House wants to see you. Now, you have to understand, this was the era of Haldeman and Ehrlichman. People went to the White House and were never seen again. This was not something that a 35-year-old with 3 little kids wanted to hear. So both of us went under my desk, and she said, you got to go to the White House. All right, I went to the White House, and there was sitting around all the president's men. I'm sorry, there were no women in that group. And the chairman of the Council of Economic Advisors, Herb Stein, looked at me and he said, Dr. Altman, do you know how much money we're spending on health care? Well, truth of the matter is, I really didn't know. But I suspected, well, but before I had a chance, he said, we are spending $75 billion. It amounts to 8.5% of GDP. And if we reach 8%, our whole way of life is going to deteriorate. For those of you who haven't been keeping score, it is now 3.2 trillion, 18% of GDP. And he said, you're going to be in charge of controlling healthcare costs. The President of the United States wants me to control health. I'm 32 years old. I don't give a damn about the healthcare system. I'm going to control healthcare costs. I'm going to do it. I can do that. I'm an economist, second to surgeons. We're the most arrogant people you ever met. So we begin to control. Now, remember, this is a Republican administration, so we're going to control the most powerful industry in America, but the Republicans wouldn't put anybody in charge. So we said, well, you know, we're going to control, we're going to have wage and price controls and stuff like that. We have to sort of find out what's going on. So we said, we have to have somebody to evaluate it. They said, we know the perfect group to evaluate this. We're going to have the Internal Revenue Service evaluated. The doctors are really afraid of the IRS. I said, that's a wonderful idea. So we begin to regulate healthcare costs, and I'm in charge. After about 8 months, I get a call from the Internal Revenue Service, and they come to see me. And these guys with necks the size of me come in, and they say, do you know how complicated the American healthcare system? We haven't got a clue what they're doing. We're not going to do it. I said, the President of the United States wants you to do it. We said, we don't give a flying. We're not doing it. It would take every IRS agent in America to do it, and we still wouldn't know what they're doing. We're not going to do it. So I said, you have to do it. This went on for 20 minutes. Finally, I knew I was in a lot of trouble. So I finally said to them, would you please not tell anybody? Don't tell the doctors. Don't tell the hospitals. They will think the IRS is controlling their healthcare costs. So then, okay, so that puts, and then I get now remember, you know, I get a bright idea. I said, you know, there's this Medicare program. And after all, the Medicare program is a government program. Why don't we use the Medicare program to really regulate the American healthcare system and put pressure on them, because we have no idea what the private sector is going to do. I thought that was a brilliant idea. All of a sudden, I get a call from Bob Ball. I'd like to see you. Now, for those of you who know Bob Ball, seeing Bob Ball, now, you know, I mean, it wasn't clear who was in charge of who, but this was a very respected senior person who had created the Social Security, been involved, created Medicare. He and Art Hess. I mean, even I was intimidated, which took a lot. So I went to see Bob Ball, and here's the story. He looked at me, and he pulled down his glasses, and he said, "I don't like this idea." I said, "Well, what idea don't you like?" And he said, "You are going to make the Medicare program as a regulatory arm of the healthcare system." I said, "Well, what's wrong with that?" He said, "Look, we made a commitment to the American people that every one of them would have access to complete health care, all the hospitals, all the doctors, and that we would be a decent payer of health care. As a matter of fact, we had created the private Blue Cross insurance mechanism for paying cost-based reimbursement so that this government program would be a decent payer. And you are going to separate the Medicare program from the private market. If you do that, over time, what will be created will be a differential between Medicare and private insurance, which over time will lead to Medicare beneficiaries not getting access to the best that America has to provide, both in terms of hospitals and doctors." Now, at that point, I didn't appreciate what he was talking about. And I sort of won the argument and convinced the secretary that we needed to have the Medicare program be the regulatory arm. And I'm here to tell you that was a gigantic mistake. Bob Ball was absolutely right, as he was on so many other things. Nancy, you got it so right. So, I mean, I hate to this has been a wonderful experience. I've really loved being here. This is a wonderful opportunity, but I need to do a little policy analysis. I'm sorry. So if you'll put up this one slide that I have. I'm here to tell you Social Security and Medicare are not the same. They are fundamentally different programs. In Social Security, Walmart and Safeway and every other doesn't worry about what Social Security does. Social Security is a wonderful program. I couldn't agree more with you, Nancy. And by the way, I am convinced in the shtetl in Poland, the two of us were related. But Social Security and Medicare are fundamentally different programs. Social Security is really a fundamental, and I strongly believe it, but Medicare is really at the heart of the American healthcare system, and it separates them in fundamental ways, and I have spent my life trying to make them both work. Well, I'm here to explain to you what is going on in America today. This is not an ideological. I know many of you believe Medicare for all is the right model. And I understand that and can be somewhat supportive of, but I must admit, I'm an affordable care guy. I believe the Affordable Care Program is exactly the right balance, but both of us, both groups want the same thing, which is guaranteed, universal, decent coverage for all Americans. And I beg you, as groups, we need to work together. There is another set of forces out there that want to do evil to both of us. And I ask you, Bill, the Academy has to bring us together. This battle between Medicare for All and the Affordable Care Act is going to destroy us both. So here is this. We need to work together. This is not something that we can afford. So here's the story that I'm about to tell you. For those of you who don't spend as much time about the American healthcare system as I do, look at this chart. Beginning in the mid-1990s, we have seen a violation of the Bob Ball principle, which is growing by leaps and bounds. Currently, between that the private sector and Medicare are going in opposite directions. The gap between what private pays and what public pays is approaching 70%, and in many parts of the country, it is over 100%, which means the same kind of patients. Now, the private and public are paying privately twice as much as Medicare. This is not healthy. This is not good for Medicare. Now, this is exactly what Bob Ball argued against, and he was absolutely right. We cannot see Medicare and the private insurance market move in opposite directions. If we do and continue to see that, you will see Medicare beneficiaries becoming denied access to care. Fortunately, currently, I know of hospitals are denying Medicare people. And I'm a Medicare recipient. I've had wonderful care from Medicare, although I wish they'd send me balloons when I got operated on. But that's another question. The point here is that this gap is getting wide, and it is not. Now, if you flip from hospital side to physicians, we're already seeing the canary in the coal mine. More and more primary care physicians are now going to concierge medicine, which I believe is immoral, unethical, fattening, and I must admit I joined it because I've lost 3 primary care physicians in the last 4 years. And if I went around the room, you will find several of you who are already having, because they feel that Medicare is no longer paying them an adequate rate. Now, I'm not here to argue whether Medicare is the right number or not, and I'm not here to argue whether Medicare should raise the rate. What I am saying is that this is a dangerous for Medicare and for the rights of others. We have to work to figure it out. Maryland and Massachusetts are trying to make a difference. And I would encourage you to look at what we're doing in Massachusetts and Maryland to try to make sure that this gap does not get wider. But the important thing that I want to bring back how wise Bob Ball was, it is a bad public policy for these 2 important programs to become so widely different. And as I said, over the years, I really began to appreciate how smart he was and how stupid I was. And I hope I've learned a little bit. So, in closing, Bob Ball was an incredible human being. He represented the best of civil servant, as you pointed out. I wish I was smart enough at 32 to appreciate that. But I implore all of us, we need to work together. It is so important that the American people get a comprehensive, decent health care system. Medicare for All has a lot of advantages. I'm not arguing against it, but it has some big disadvantages, particularly in terms of this. So we need to work together, and it's your responsibility to bring us together, Bill, and make this academy, make us both work together so that we can find the right solution. What a pleasure it is to have the Bob Ball Award. I want to thank you, Bill, for giving me this opportunity. I want to thank, Chris for, bringing, Bill Clinton on the scene, and Karen and Chip, I mean, the idea that Chip fired me is that, you know, I haven't recovered yet, but it's all right. So thank you all very much. This has been a wonderful opportunity.
In front of all of you, there should be a glass of champagne. So please join me in raising your glasses in honor of Nancy and Stuart Altman, all they've done and all they will do on behalf of social insurance. So thank you. Hear, hear. And Stuart, I think I am authorized to say on behalf of the Academy, we accept your challenge. A couple other comments before we end this wonderful evening, and thanks again to all of you for being part of it. As you know, events like this take a lot of work, and the work gets done by the small but extraordinarily dedicated staff of the Academy. So I'd like to ask all the members of the Academy staff to please rise. They may have run out already to work some more, but thank you for all you've done. In particular, our Director of Development, Christine Quinio, really was the person who did the bulk of the work to help the event committee succeed. Christine, again, thank you for everything you did. So you might be saying, what's next? And I do have another announcement to make. We had a meeting of our board of directors today, and the board unanimously approved the announcement of a competition. And that is, while the name of the Academy is sacrosanct, we are, always have been, and probably always will be, the National Academy of Social Insurance. In order to be more relevant and to resonate with different stakeholders, particularly the generation that is today most at risk, and that's millennials and future generations, we thought it was time for the Academy to be able to describe itself with more specificity in an emotional, compelling, and memorable way. Without changing the Academy's name, we thought we'd consider an Academy tagline. So we are opening a competition to all members of the Academy. In fact, I might add dues-paying members. To submit, and you'll be getting an announcement with details shortly, to submit your ideas for a tagline for the National Academy of Social Insurance. The board of directors and the staff will form a committee to review all of the suggestions, and out of that, it's possible will come no tagline, that's an option, or the right tagline. There'll be rules set out, and I hope all of you will begin thinking tonight of ways to make the Academy come alive with a vibrant, compelling tagline of 8 words or fewer. That's the guideline. So with that, again, thank you to all of you for being part of tonight, and we specifically thank Nancy and Stuart for being the recipients of the 2018 Bob Hall Award. Good night, everybody, and see you again soon.